And now, welcome to Healthy Veins, Healthy Legs, the radio program that gives you a leg up on how to identify and get help for ailments of the leg that can not only be cosmetically bothersome, but can actually be a big threat to your overall health and well-being. Now, here's your host, Mike Buck, and Hawaii's premier vein specialist and vascular surgeon, Dr. Robert Kistner.
Well, aloha from Honolulu, and welcome once again to Healthy Veins, Healthy Legs. Like the man said, it's time to talk story with Dr. Robert Kistner. And I'm Mike Buck, your genial host, and we're very, very pleased to be bringing you this program. It is a program not designed to sell you anything, but it is designed to make you very, very aware of something that many, many people here, as a matter of fact, well over a third of us, have some form of disease in our legs. And this is a venous disease we're talking about, and I have, of course, learned almost enough to give Dr. Kistner some competition in the operating theater, but not for a long time, Doc. Don't worry about that. And secondly, I'm pleased to tell you that today's program in particular is going to be about a development that happened back in 1994 that enabled people in the venous business, in the surgery business and circulation business to be able to sort of categorize different stages of this disease. And I found out, talking off the air with Dr. Kistner, that there's 6 of them. That's 6 stages of this disease. I want to point out in the very beginning, before Dr. Kistner even starts, though, that we cannot diagnose nor really see exactly what's going on with your legs or put you on this chart in a particular position right away, because it's all kinds of variables, and we're going to explain what they are. But basically, there are 6 stages. It's called CEAP, C-E-A-P, and I just learned it's clinical, etiologic, anatomic, Okay, so in other words, now that I'm an expert, Dr. Kistner, let's talk about how the fact that experts since 1994 have come to agree that, gee, we can identify the different stages of this disease. And also, here it is.
Yeah, well, this is it is helpful to organize these things so they kind of tell a story from it also is not just 6 stages, but there are 6 chronologic stages. So it begins at the beginning and it has an ending, and so each one is building on a theme.
Okay, and that's what we're going to develop, these 6 stages today. And I know that it's probably not as clear as the first and second stage of a rocket. You know, once that first fuel is used up, out it goes, and stage 2. I guess there's a passing of the baton, a physical passing of the baton going from one stage to the other. Is that correct?
Yeah, well, yeah. So please take what we're saying sort of with a grain of salt, because each little stage is not a totality in itself, so it has to be taken in context with what else is going on in the leg.
Okay, now the progression, which I learned earlier, and this is what we're going to cover today. So any of you that have any concerns, and I know that a lot of you that listen to this program already come back week after week, because it is designed to give you not only an idea of what's going on in your legs, but if your veins are healthy, your legs will be healthy, and everybody knows what healthy legs mean. You have a good lifestyle, a good quality of life, and that's what this program is all about. So tell us how this organization of practitioners got together, who they are, and what in 1994 was this great, I guess, series of agreements that came up with these 6 stages.
Well, what happened was there were developments through the years in the 80s, 70s, 80s, and 90s, and we began to learn so much more about the veins, as we've talked about here, with the advent of ultrasound and venography and a lot of things. As they came together, we realized that there could be value in developing an additional classification. There have been previous classifications, but we were able, through the auspices of the American Venous Forum, which is a premier society in America devoted to venous disease. Through them, an ad hoc committee was drawn up, and they met in Hawaii, and this was international experts in venous disease to develop a story and develop a classification of what the important features of venous disease really are.
Okay, so then I would imagine that there was this tremendous funnel, if you will, of everybody putting in something, and then a group sitting around this ad hoc committee saying, okay, this is where all the agreement is. Now, how do we put this down in a chart that a new venous doctor or a patient can understand?
Well, It had its beginning, didn't have anything to do with anything except communication between the physicians. So the idea was, let's get something where when we make a diagnosis in Hawaii and somebody else makes it in New York and another person in Israel, that they all are using the same criteria.
Gotcha.
So this was same page. That's a great way.
Now, here's the thing. These are 6 stages, but there must be some multiples in there. In other words, there's 6 stages. And those are the big stages. But to transgress from one to the next, that's why I ask is it like the passing of a baton? Or is there one day where all of a sudden Mike's legs are not stage 1, they're stage 2?
Right, no. And they're not that, and they're not necessarily, everybody doesn't go through every stage and going from A to Z, and everybody doesn't go from A to Z and all that. There are a lot of things that we have reservations that we have to build into this. So we're going into kind of 101 here.
Yeah.
And let me just start with one thing. In the veins, remember we said that we can have blood clots, which we're not really talking about today, or we can have varicose veins, and then each one of those is sort of the beginning of a different form of venous disease. And a same individual can have elements of both. But today's conversation is going to be about varicose veins, where they start, how they develop, how long they last, and what they ultimately can cause.
Yeah, and I do know too that the different things would indicate different procedures. So hopefully we can slide in some of these categories and in these stages and mention the treatment you go through to either prolong the time that it gets to go to the next stage, or maybe even not get to the next stage.
Let's start there, because from stage 1 to 3, it affects a large part of the population and is not as serious as from 4 to 6.
Okay, now I'm going to assume what you've been able to teach me and pound into my stubborn head in previous programs is stage 1 has got to be the bane of what ladies like. These spider veins. They don't like these spider veins. Is that the first stage?
You got it.
Okay. Good. And now I know what stage 1 is, and all we have to do is teach me the other 5.
Well, so
or all of us.
60% of the adult population has that.
Stage
it's
1 is 60%.
Yeah, so it's more than half. So it's almost the normal condition is to have some of these little things.
Yeah.
And there's spider veins. So why spider veins? It's just a very superficial bluish or reddish discoloration. It's in the skin. It's not under the skin. And it really doesn't cause symptoms except cosmetic symptoms.
Let me ask you a question on that, because I meant to do this in previous programs. We're all different. I mean, we have, particularly here in Hawaii, we have multi-ethnicities, we have interblending and everything else. Now, do these spider veins, we know on somebody with beautiful, clear, almost translucent lily white skin, these things stick out, like a sore thumb. Are there other ethnicities or other colors where this takes a lot longer to manifest to be seen?
Well, it's less obvious in a dark-skinned individual, but we have all sizes, shapes, and colors here, and we've seen all sizes, shapes, and colors, concerned about them. Remember, it's mainly cosmetic and not very much in symptomatic, painful, heavy legs, that sort of thing. But the first stage does show that there's something abnormal about the veins. And since it affects 60%, I don't know that it's abnormal. Maybe it's a normal stuff.
I think maybe there are certain things, and if you speak with a dentist or an eye doctor or anybody else, sooner or later you're going to see them. I mean,
that's right.
And so you almost have to have the same philosophy here. But I think the more important thing to look at here is as we develop and explain what these 6 stages are. Some of them become more than cosmetic pretty quickly, and some of them become a real problem down the road. So we've got to treat each one of these as, oh my goodness, what am I going to do about this before it becomes that?
Well, let's start with stage 1 then, like you did.
Spiders.
So lots of people get them. The older you get, the more you get, and the more people are affected. So in the 20s, probably not very many people. By the 40s, probably about half of people, and by the 80s, probably about 80% of people. Okay, so that's what it is. Now, is it important? Well, it's important with the patient's image of themselves. We've asked patient after patient why they're coming in for treatment, and they all say It's not for my boyfriend. It's not for my husband. It's not for what I look like when I go to the beach. It's for me.
Mm-hmm.
It's my own image. So this is very important. It's like you comb your hair. It's like you brush your whatever.
I found this to be true, gang, because ever since I've been doing this show with Dr. Kistner, I've taken talked to a bunch of people, family members and others, and you're right. It is self-esteem more than what others' perception is, and I think maybe it's. I don't know if guys take it any gentler than others, but I think that ladies just don't like to look at aging, and they look at aging as this being a part of aging. Is that a fair assessment sometimes?
Well, they're certainly more conscious.
Mm-hmm.
For instance, not many men look at the back of their legs.
Yeah.
Well, women do all the time.
Uh-huh.
It's really interesting.
Well, figure it out. I mean, thank goodness most of us guys don't shave our legs. So what the heck? What are we going to look at the back of our legs for? Who cares, right?
But we look at the ladies' legs.
Of course we do.
All right.
Yeah.
So there you go.
Yeah.
So anyway, these are out there. They're very, very important.
Mm-hmm.
Cosmetic, they're as important. Cosmetic is probably more important than much of the medical stuff we talk about anyway.
Okay.
So it's not to downgrade the importance of these. I think they're extremely important. And they're very, very important to people's well-being and sense of good health.
Real quickly, because I know that we're going to have to devote most of the program on these 6 stages, but in the spider veins, in these little tiny ones, have the treatment for them changed too, like everything else is changing with regards of how you deal with them?
It's evolved, but basically there are 2 basic types of treatment. One is injection. It's called sclerotherapy. It's a long name, but that just means to inject a medication into the inside of the vein that'll cause the vein to disappear.
Okay.
That works.
Yeah, but by the way, one thing that has improved on that is the application, the needle. You showed me some needles in your office that are really, really tiny, and they're way less of a problem to put into somebody's vein than they used to be.
Well, can we talk about your leg?
Oh, yeah.
So you had some on your thigh.
Yep.
And they were there for a long time. You also had serious vein disease, but you had this stuff.
Mm-hmm.
Tell me, did it bother you at all?
No. The treatment process for these needles, once you know what they are, they're so tiny and they're surgically so sharp because of technology that they're really not that anywhere near as invasive as I thought they were going to be.
Right.
Yeah.
Now, did you feel better having the veins treated than not? Does
Well,
it make much difference?
I'm a work in progress, and I'm a guy. But I can tell you that there was one on top of my left thigh. There was it took about 6 or 8 inches, and it was sort of round with a bunch of veins in it.
It was a big one. Yeah.
That's down to about 10% of what it used to be. So
Really?
I see that every day. And so that makes me, that's not looking too bad. So I can understand particularly why a lot of ladies would rather get rid of those things.
Yeah, so not that you're not good looking, but if you were a beautiful 5'2" blonde lady, well, it'd be very different.
Okay, so that's the reality of it, and there's basically two kinds of treatments. One is the what you said, the sclerosis, which is the injection of this stuff.
The other's laser.
And laser.
So there's a superficial laser. There's also a deep laser. So
Okay.
Laser is kind of a magic name with people, and they think it's wonderful and painless and all this sort of thing. Well, laser is a wonderful tool, but it is not quite as good for leg veins as the injection.
Okay.
So, but it's useful, and people have a lot of expensive laser equipment, and some people are expert in doing that. So
Okay, so
those two means to treat it.
That is a real thumbnail sketch of stage one. And the stage one, once again, and Doc, I know that you've explained this to a lot of people. There are reasons why people want to get rid of them, women and men, but these are not lifestyle threatening nor too health threatening.
Great point. So stage one does not necessarily lead to stage two.
Good.
Okay, so we say 60% of people have only stage one. So there's 100% of people in the total population.
Mm-hmm.
Only 10% of the population don't have some form of venous problem. So that leaves 60 plus 10 is 70, and the other 30% have some form of the next 5 stages of venous disease.
Okay, after stage one, stage two is what?
Varicose veins.
Okay.
Now, because you have stage one, you're not necessarily go to stage two, but it jumps down to maybe a third or a half or something like that. Of those will develop people will develop varicose veins.
How about this? Can you have varicose veins with no spider veins?
Yeah, but the spider. Yes, you can.
Mm-hmm.
But most people have some spider veins. Okay. So it's pretty hard to separate them.
Okay.
It's more important that because you have spider veins, you're not going to go to varicose veins necessarily.
Now, varicose veins, and that's when it widely differs. They are much more of a problem than spider veins.
Okay, so now most people really can't differentiate between spider and a varicose vein, and I don't think we can teach that over the air. But the characteristics of a varicose vein are that it's under the skin, and it kind of looks like a bubble on your leg, or a grape, or a little thing that pops out when you stand up. And the interesting thing about it is, if you lie down and raise your leg above your heart and kick your leg up toward the ceiling, the varicose vein tends to go away because the blood drains out and the color drains out. You don't see it.
Okay.
Another interesting place where you don't see it is if you get morbidly obese, you have so much fatty tissue around the vein that you don't see it.
Yeah, and that's where Doc's being kind. That's where I was at one point in my life. I had been diagnosed as morbidly obese. That's when Dr. Kistner and I met many, many years ago. Happy to say that when you get rid of the morbid obesity, now you can see the varicose veins. I'm not happy about it, but at least once we discovered that I had varicosity that needed to be treated, we could treat it, because otherwise it would have gone unchecked.
That's right.
Yeah.
That's right. But you might have the symptoms, but you don't see the veins.
Mm-hmm.
Now, let's talk about varicose veins, because that has stages. So it has an early stage and a late stage. And that's a pretty important differentiation, I think. The varicose veins most often present somewhere around the knee, maybe from the mid-calf up to the mid-thigh. Most people, if you ask them, where was your first varicose vein, that's going to be the answer. Well, I saw something on the back of my calf or around my knee. Okay. And what they'll see is a little bubble, and it doesn't hurt and it doesn't anything, and they just see kind of a bubble there. They don't have pain. They don't have anything else. If we analyze that leg with ultrasound, then we'll find that all the veins are normal except for just a few veins in that area where the veins are dilated. And if we look at their valves, there are little valves that are not working in those veins. That's a local peripheral problem. It might cause some mild symptoms, or it might not.
When you say symptoms, discomfort of some kind.
Yeah,
okay.
Thank you. Symptoms would be like heaviness or itching.
Stinging, itching.
Yeah, you got it. Okay, that kind of thing. Okay. And people don't take medicine for it and all that, and it's just there. Now, about 3% of those people may go on to get ulcers. So not everybody goes on to the late stages, but ulcers are the end stage. That's stage 6 that we're going to get to.
Yeah, and this, by the way, is something that I've also got some experience with, and we'll share that when we get to stage 6.
So let's say the 6 stages. Stage 1 is spider veins. Stage 6 is ulcers. That's sores on your leg, usually down around your ankle. Okay, so we're talking.
Yeah, which, by the way, topical medicine on the outside doesn't fix, because I know this for a fact. You think you're doing well, but you're not. Yeah.
So early stage 2, varicose veins, just a peripheral vein somewhere, probably minor symptoms, and not necessarily going to go on to cause bad trouble. Go to the late stage, then, of C2, which is varicose veins, but these are continuous up and down the leg. They start in the up in the upper thigh, and they may go all the way down to the ankle. The skin is still a normal color. The skin is normal texture. It looks fine, but you have these bubbles up and down your leg.
Little bumps.
We look at those with the ultrasound. We see that there's connection up and down the leg. Now, once they get to that stage, suddenly the disease is more significant. And we're getting to the point where you have a pretty good chance of going on from that to ulcer stage, and that might be in the range of 10 to 20% of those people. Remember, it was 3% in the early stage of C2. Now, the later stage of C2 is probably up to 10 or 20% are going to go on to may go on to ulceration.
Okay, now, because of the time constraints of the program, people have got to understand that these things are not like dealing a deck of cards. In a half an hour, you can see going from stage 1 to stage 4. These all are taking course over a certain period of time, I guess quicker for some than others.
Yeah, and there's a huge variation, and so you might, you normally would get stage 1 to early 2 stage begin maybe in adolescence,
Mm-hmm.
or up to age 25 to 30, 35. In the next 10 or 15 years.
That's a long time. I mean, we got to be sure people understand that.
Yeah. So somebody might go 10, 20, 30 years and just have early stage and still progress. Okay. Well, now we're at late stage 2. The patients probably are in their 40s, 35, 45 age group. They're fully active, but they're beginning to get more symptoms now. Now they're having aching when they stand for a long period of time. They want to get off their feet at the end of the day and elevate them. They get fatigued. They may not do some of the things that they like to do. They might begin taking a Tylenol or some kind of a pill because it makes them feel better because the leg has stinging and so forth.
When you self-diagnose and do something like that, are there dangers that you're masking a symptom, but the cause of the symptom is getting worse because you're just covering up with some sort of medication?
Well, I mean, that may be the fact.
Mm-hmm.
It can be, yeah. But that's not a reason not to take it.
Of course.
Yeah.
I mean, comfort is of import.
But it is significant if you're taking it. Well, why are you taking it?
Mm-hmm.
Because you don't feel right, and so then the physician would use that as a clue to look deeper.
Yeah, I think that people that refuse to alter their diet once they find out they have high blood pressure, their doctor gives them blood pressure medicine. So their blood pressure seems normal, but it's only normal because they've been medicating.
Yeah, I see what you're saying.
Yeah. So therefore, if you've already got to some of these stages that Dr. Kistner is mentioning, and you are taking medication for it, and you think that the cause has gone away, probably hasn't.
Okay.
Yeah.
Now, okay, so we're pretty well through stage 2, right?
Mm-hmm.
You want to go on to stage
3?
two?
We're getting up to about where we're just getting to the half-century mark. We're looking at getting around 50-ish.
Yeah,
in
probably,
years.
Probably.
Okay, so stage 3, is it a light switch going off between 2 and 3, or is it another gradient change?
Yeah, it's very, very shady,
Mm-hmm.
very tinted. What happens is a certain percent, maybe 15% of people, will develop something called swelling. Now, this is a tough one because swelling can be due to lots and lots of causes, but one of those causes is venous disease, okay? So just because you have swelling doesn't put you into this cascade. But let's say that you had varicose veins and then you begin to see swelling. What kind of swelling? This is typically swelling that occurs in the lower part of the leg or the ankle, usually not the foot for venous disease, and it tends to occur toward the end of the day. So you've been on your feet all day, maybe sitting at a desk, maybe you've been just standing. Or people that, like hairdressers or salespeople, standing there.
Or my favorite category, my grandfather was a dentist. And,
Perfect.
And he was in great shape for most of his life. He practiced well into his 80s, but his legs it took a toll on him, a serious toll. And it came on gradually. So he never really thought of himself as being infirm, but when the poor guy walked around, he didn't walk around so well.
That's right.
Yeah.
Okay. So that kind of swelling, that is stage 3.
Mm-hmm.
And so when swelling, let me talk about swelling just a little bit. It's really a very serious problem to some people because if you have swollen legs, for one thing, if you injure your leg, it won't heal as well. If you get an ulcer, an ulcer on your leg, it may not heal at all for weeks and months, even years. It becomes a very important part of your daily life. You have to take care of the thing, and the best treatment for it is to get off your legs and elevate them, which is not consistent.
Down goes the lifestyle.
That's right.
Sure.
There you go. Okay. So all of this swelling is a big deal. Now, swelling also occurs with heart failure, with kidney failure, with poor nutrition, and a lot of other things that don't carry any of these kind of sequelae.
And that's why, gang, in the very beginning of this program, I sort of pre-warned you that if you manifest or if you have some of these symptoms, it doesn't automatically equate to the stages that we're going to talk about today, but it's sort of a wake-up call. If you've got swelling, if it's not due to edema or salt or diabetes or obesity, or it could be venous, it could be others. So no matter what, when you get to the swelling, somebody's got to take a look at you.
Yeah, so you may be seeing, so you probably talked to your primary care doc. So he's seeing all kinds of problems, some of which are vein, but most of them are due to your heart or your kidneys or something. He's most likely to give you a pill. It's a water pill or a diuretic, and there are a lot of those. And many people in the older age groups will be on these pills for good and solid reasons because they have something wrong with their heart or kidneys.
Sure. Now,
if your problem happens to be the veins in the leg, that pill may help a little bit, but that's not the right treatment for that. For that kind of swelling, you really begin to need compression, and support stockings are the first line of defense.
And that's where I always got to butt in, because I went through the bell curve of learning about support stockings, and I can tell you, in the period of time it took me to finally realize how important this was, it's been longer than 10 years. And today's compression socks, friends and neighbors, are not Grandpa's compression socks of a long time ago, when it was like putting your legs in a vice and not being able to walk around too well. I just got back from a trip, and before I went on the trip, Dr. Kistner gave me a prescription and a referral to a place, and I went and got some new socks. I can honestly tell you, the trip was no problem. Wore them the whole time, and didn't experience the swelling that I always have traveling. It was very, very. That's a victory.
Hey, Mike, what color stockings did you get?
I got 2 blacks, a dark brown, and a khaki-colored tan.
How about shocking pink? You didn't go there.
I didn't go the pink.
But you can get them.
But you can.
Yeah.
And there's also something else. And there's a lot of people that wonder about this, and if you are one of them out there right now, I might be able to help you with something. If you put another sock on over one of these compression stockings, if it's too tight, it's not good, is it? Because I did that once by mistake.
Yeah, what happens if you put a second compression stocking over the first one, you get double the compression on your leg, and that can get too tight.
Yep. Okay. But so let that be fair warning. All right. So anyway, that is that's part of the swelling thing, and boy, your legs just don't swell when you wear those socks, not as much anyway.
Okay, so let's go back to our cascade of 6 stages.
Mm-hmm.
Well, at this point, you really are progressing on. You're down to about 13% of the population or so forth who may have some swelling and may have something to do with your veins. The next stage will be stage 4, and that's where the pedal hits the metal. You're getting serious about the problems. This is a very important stage, and the first 3 stages, lots of people have them. They deal with them as a minor problem, and maybe you have your veins fixed, maybe you don't along the way. When you get to stage 4, which begins to be irreversible changes in the skin, now you got something that not only do you have it, but you can't totally get rid of it because there are changes in your tissues.
These are physical changes that manifest themselves usually, from what I understand, as discoloration of some kind.
It starts with discoloration.
Mm-hmm.
So lots of people, and it's a brownish discoloration.
Yep.
Now, there's lots and lots of brownish discoloration, and much of it has nothing to do with your veins.
All right.
But it is one of the stages in venous disease, because what happens in vein disease is that probably the red blood cells get loose in the tissues, perhaps from swelling or whatever, stasis in your leg, and they break down and leave a pigment. It's called hemosiderin.
Okay. So it's something that it's being left.
It'll stain your skin. Yeah.
Okay.
And it can get lighter. Once it occurs, it can get lighter with treatment, but it probably will never totally go away.
A lot of people think, from what I did, because I did back in the day when I noticed that it was from being sunburned or being dried or something, and it'll go away.
Right.
Yeah.
And
Never.
and it's hard. Well, it's hard to differentiate.
Yeah.
But anyway, this is a real important stage. It's not the most critical stage of 4. It's an early stage 4A.
Is your skin less effective once it gets this way? And then, in other words, is your skin that maybe used to help you now causing you some additional problems?
Not yet.
Okay.
So far, your skin's okay.
Okay.
But the next stage, your skin begins to be affected, and the next stage is thickening of the skin, a leathery kind of a skin, and so the typical person at this stage has maybe some swelling in their leg. They'll have brownish to dark dark brown or even blackish discoloration. Then they get kind of a leathery type of skin.
Okay, now, is that still within stage 4?
That's 4B,
Okay.
and that's serious.
Okay, now, let me ask you this, because I know a lot of people here in Hawaii particularly, and someday people throughout the country, maybe throughout the world, are going to be listening to this program. There are certain other conditions, say like diabetes, where diabetes does affect everybody. Oh, the guy's got diabetes. They just assume that because their legs are dark or blackened. Is there a lot of confusion as to what causes some of these things like obesity, diabetes, and varicose veins and bad skin?
Yeah, and it's not only confusion. There are multiple things that can enter into it. So these things kind of merge, and it's hard to separate them. Yeah, and diabetics can get a discoloration in their legs, a brownish discoloration for sure, which may or may not have anything to do with the veins. But the important thing is what's happening in the skin, because the skin now is beginning to change. And so the skin is an organ. It's the biggest organ in our body, and it has a physiologic function and cells that do certain jobs, sweating and color, temperature control, and all kinds of things. But within the skin, you begin to get scar tissue. Now, what happens is that the processes happen so that the normal cells are replaced by abnormal cells, which are fibrosis and scarring. That won't go back to normal.
Yeah.
So it's beginning of a one-way street. Okay.
And now, since we talked, we're into the stage 4B or further into stage 4. Is this something that is accelerating also just because of the age of the skin?
Perhaps.
Yeah.
Perhaps because the reason I say that is that it takes a long time for this to begin to develop, and during that time the person ages. So the frequency of these is very high in people after 70, 80 years of age, up to between 40 and 70. Some people get it, but very often those are people who got into trouble with their veins more through blood clots than through varicose veins.
Yeah, and we'll move into that pretty soon. But so now we've got these skin changes that first maybe are a little pesky because they're cosmetic or looking or just appearance looking.
Good.
And then secondly, they start taking on some other conditions which are not good because you get that leatheriness or that dryness or that cracking, and maybe that's going to lend itself as we start moving into the next problems where skin used to be of help to certain things. Now it's not of help, and it's hindering.
Now let's go to obesity.
Okay.
Massive obesity can produce all of these changes without anything wrong with the veins, and it's really hard the person can't differentiate. Physicians can't differentiate. You really need to have a specialist do ultrasound studies to make this determination. But obesity has an effect on the venous return by raising the pressure in the abdomen so that the blood can't get back up probably, and there is an element of high pressure and a development of edema, water in the tissues, which ultimately leads to scarring and replacement of the tissues. So they kind of blend together. They're separate problems, and they need to be differentiated.
There's often said, and I know this because I speak at obesity clinics, and I know a fair bit about this subject, that as you get rid of or treat some conditions, other things also are better off. For instance, if somebody has diabetes, type 2 or whatever, and is obese, and they recognize this, now they get treatment. Almost always when you curb your obesity or get rid of it, the type 2 diabetes goes into either remission or disappears. What about the venous damage that's been done on top of these conditions? If you're no longer considered morbidly obese, and if you've now gotten rid of your type 2 diabetes, are your veins going to heal themselves?
Okay, that's a great question. And so the answer is reversing your morbid obesity will not reverse the damage to your veins.
Yeah, in other words, once you've damaged them, you either have to get rid of them or have them treated. Something's got to happen because they're not going to get better.
But if you happen to have those changes and didn't have varicose veins, then all this stuff goes away.
Okay.
Or improves.
Yeah.
Okay.
So good news.
Okay. Yeah. Can be good news. So now this is really a very important stage of it. And again, it's affecting about 15% of people. The rest of the stages go down into 1 and 2%.
Mm-hmm.
And when you get to a deep 4B stage, you're probably down to around 3 or 4% of the population. So
we don't want to scare everybody to death in the audience today. They're not all going to 4B.
That's right, and because you got, and so when you first get your spider vein in your leg, you're not necessarily on your way to Okay.
Don't call the gurney, and don't go rushing out of the doctor with an emergency yet.
Exactly, exactly, man. Relax, and because you got about 50 years to work this stuff out. Okay. So, but anyway,
an overnight success, right? Yeah, gee whiz.
So, because it takes a long time to get into trouble, it takes a while to get out of trouble, doesn't it?
Yeah, and that's another thing, and in subsequent programs are going to deal with that. Sometimes it takes years, decades to get to a condition where you need treatment. And you get this wonderful treatment, your legs don't go back to, like, before 50 years in 50 days. It just doesn't happen. You have to be patient. That's why maybe they call us patients, because we have to be patient. You know?
Well, that's true. But you know, that's true for support stockings, because they can help you all the way through life. And you know, everybody in our office wears support stockings because we feel better. We're on our legs all the time.
Yeah.
We just feel springier and better with
Well, listen, I'm starting to be the poster boy for these friends, and if you learn nothing more about this program with Dr. Kistner from the Kistner Vein Clinic, Healthy Veins, Healthy Legs, you really ought to think about these socks, because they are. I don't want to say they're a crutch. They're not a walking stick. They're not crutches. They're not a brace. But they certainly do help, because we just need it. We're not getting as much exercise as we used to. As a country, we've put on more weight and we put on more stress on our legs, so we deserve to have these. Take a look at these stockings when you can.
Well, let's talk about stockings for a minute.
Yeah.
So if you're at home and you're beginning to see some of these signs, a really intelligent thing to do is to go get a pair of support stockings. Now, there's a whole world of support stockings. Mm-hmm. Some are over-the-counter and some are medical grade. Those that are over-the-counter are generally made pretty well, and all the stores will have their own brand.
Sure, you see them at the grocery, not the grocery stores, but the big boxes, and certainly at all the drugstores.
Yeah, you do. And so they'll have them, and if they're labeled with a certain amount of compression, then that's probably pretty reliable. And so most of them are made to some specification. Now, the difference between that stocking and the one you get in the medical store is significant, because it's not made as well. It's not made to last as long. You don't get the same fit, so you might not get exactly the right stocking. Remember, these stockings are made somewhere for a model, and our legs are quite different.
Yeah, the last time I looked, Twiggy's legs and my legs are significantly different.
That's right. So they have to cover a big ground. So there's a great advantage to getting the medical grade if you have a serious problem. But if you don't have a serious problem, you just want to wear something, for instance, for flying on airplanes. Really, all adults would be much healthier if they wore a knee-length support stocking when they fly for 3 or 4 or 5 hours at a time.
Sure.
And
that's how long we fly. And unless it's your little neighbor island jaunt, both Dr. Kistner and I both just got back from the mainland. You're flying 5.5 hours in each direction. That's 10 hours of sedentary blood settling in your legs.
Yeah. So some of those people will, every once in a while, somebody will get a blood clot from them.
Yeah, I bet.
Yeah. Okay. Okay. Well, we're back to the Cascade.
Yeah. Now we're going from 4B into thin ice. We're going to
the real deal now.
Yeah.
Okay, so we're at the end spot. The last 2 spots, class 5 and 6, basically are about ulcers. And ulcers, remember, ulcers, I don't know what they mean to everybody. A lot of people think of stomach ulcers. And what do they mean to you?
Perforated ulcer. Well, I know what they mean to me because of you. I went to Dr. Kistner a long time ago with what started out as a trauma to a leg. But what was going on inside the leg just said, thank you very much, and now I'm coming out. Because what I had is an ulcer, and this is a puka that just wouldn't heal.
Yeah.
That's what I think an ulcer is, a hole that won't heal.
That's right. It's a sore that doesn't heal. It doesn't necessarily have to be venous. It doesn't have to be in the leg, and so it can be anywhere. So a sore that doesn't heal very well, it becomes an ulcer. So we get the word chronic. Chronic means that under normal treatment, it didn't get well. Usually it means treatment for a month, and some people require 3 months. But that kind of a thing.
Okay, now, when you've treated an ulcer, when you've had an ulcer treated, what's the likelihood that you get an additional one? Maybe not that one coming back, but another one. I mean, are you now predisposed to ulcers?
You said it.
Mm-hmm.
Once you get an ulcer, look now, you're all the way down. We're a venous ulcer now.
Mm-hmm.
We're going back to that.
Yeah.
Okay. Remember, you're all the way down the cascade to stage 5.
Mm-hmm.
So, well, actually, it's stage 6 when you get an open ulcer. And it is a strange, but the stage 6 is open ulcer. Stage 5 is history of ulcer or a recurrent ulcer.
You know, Doc, I think this would be interesting because this is on the radio, and it's very difficult sometimes. And I explained early in the program, folks, that these are broad terms, broad paints of the brush here, and we don't want anybody getting self-diagnosing and trying to do things that silly. But this gives you a basic idea of this 6 stages, the CEAP thing that got made in 1994 by a number of professionals in this field, how to sort of label the different progressions. So what I'm getting at is that maybe people should know when we talk about ulcers what they look like. I mean, it's a sore. Can it be as small around as the end of a pencil, or in my case, it was big around as a tennis ball? It's terrible.
It can be as big around as a grapefruit.
Yeah.
It can be as big around as the end of a pencil.
Okay. But
and it can still be serious.
Is it common for people to have multiple ulcers?
Yes, can happen.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm.
One leg more than another.
But now, let me ask you another name.
Mm-hmm.
Have you ever heard of the name Gaiter area?
Gaiter.
Gaiter. Okay, it's spelled Gaiter. And so what it refers to us in the profession is the lower leg, usually the inside of the leg, but can be the outside of the leg, from the ankle up to, say, the mid-calf.
Okay, the gaiter.
And that's a gaiter area.
Mm-hmm.
And so I think it has to do with stockings. I didn't look up the derivation of the name gaiter, but I think that's what it is. But anyway, within that area, people with advanced venous disease will tend to have discoloration, usually a brownish, blackish tan shade. They may have some swelling. They may have the leathery tissue. And then in the middle of that, at some point, the changes get more intense, and they get a kind of a dirty-looking sore. It's a dirty-looking because it isn't healthy tissue. It's not going to heal. May not be tender. A lot of these are not tender. Others are very tender. I don't know why that's that way, but that's the way it is.
Let me ask you this, because I know that this is where we start to get into a very gray area, excuse the expression, because we're talking about leg color. Mm-hmm. But diabetes, the first thing a doctor would tell a diabetic is you have to be very careful of watching your feet. Because sometimes you get a little ding in your foot, and because you've lost sensitivity down there, it won't heal, and you can lose that limb. What's the difference between that diabetic foot sore or ulcer and these ulcers that we're talking about? Are they pretty similar?
No, that's a very good question, and the differences are profound.
Mm-hmm.
In the diabetic, what's happened is that the arteries, not the veins, have been affected.
Oh, okay, arteries.
Right, so there's poor blood supply to that area, and what's happened is that there's not enough oxygen interchange going on in the tissues because the circulation is deficient. The circulation can't get there. The arteries are blocked up. In the veins, that's not true.
Mm-hmm. Okay.
In the veins, the blood has gotten there, but it can't get away from it very well.
Yeah.
And so there are different physiologic effects. But the other thing that happens in diabetes is that the nervous system is knocked out with something called neuropathy. And that is the sensory nerves that give us feeling and we know where our toes are and all that. They get knocked out. So the diabetic typically has lost eyesight to some degree. Mm-hmm. They've lost the feeling in their feet. So they injure their foot. They don't feel it. And they've lost the circulation, they can't heal it.
Yeah, and here in Hawaii,
in triple jeopardy.
Yeah, here in Hawaii, we're wearing slippers, we're barefoot.
That's right.
And a lot of times, You just don't feel it. I mean, I think even people that are in pretty normal and good shape, if you've been walking barefoot most of your life, which a lot of us have here in Hawaii, your feet are like alligator skin anyway.
That's right.
So when you ding the outside, you don't even feel it.
Don't feel it. Don't think about it. You grew up all your life, weren't worried about it. But those are the things in diabetes that lead to amputation. I mean, that's a very, very serious disease. In venous disease, it doesn't go to amputation, but what it does do is fails to heal, recurs very frequently. You asked about recurrence. We're going to go there in a minute. And because of that, it's a chronic problem that seriously interferes with your way of life.
Now, if untreated, this is an ulcer. This is a hole or a little sore that won't heal. What about stuff going into it and then into your bloodstream? In other words, can you get infections from an ulcer? Can it came from inside and worked its way out, broke through the skin, but now it's exposed. Can you get sick from it?
Yeah, but inflammation plays a huge role in the development of the ulcer, but the bacterial infection and spread of infection is not very frequent.
Okay, that's good news.
It does occur. It does occur, and it's a very important part of it, but it's not the major deal.
Okay, now you mentioned that we're getting into the very small population that actually have these stages. We move from we're into stage 5, and these are ulcers. Is there another paradigm shift between 5 and 6, or is it just getting worse?
Well, let me clarify that. We're in stage. Let's mix 5 and 6.
Okay.
Because it's the way it's developed. Stage 6 is actually the open ulcer, and stage 5 is recurrent ulcers. So maybe it should be reversed.
Okay.
Okay. But anyway, we're in stage 5 and 6. But they have the same problem. Once you get to stage 5 and you have your first venous ulcer, the chance of getting a recurrent ulcer is at least 50%.
Mm-hmm.
Remember, it was 1% for the general population. It was 3% for early stage C2 and blah, blah, blah. Now we're up to 50%. So that 1 out of every 2 people is going to get another ulcer. By the time we treat the ulcers, the statistics are about a third of them have had 4 or 5 or 6 ulcers. And the other 1/3 have only had 1 ulcer, and the middle third have had between 1 and 4 ulcers. So, that's the incidence of recurrence.
When you talked earlier that they take a long time and sometimes never heal, how do they heal?
Mike, I've seen people come in that have had an ulcer. They say that it hasn't healed in 5 years, 1 up to 10 years.
That's unbelievable.
And it's not only here. You think, well, it happened here. Well, something's not good. It's all over the country. Mm-hmm. It's all over the world. And you go to the third world and you see the most horrendous ulcers you just can't believe. And there's almost nothing left to the tissue. So it's a very vicious process over time.
Yeah, and I guess the reason I ask that is because I think I'm being much more vigilant now. And maybe there are people out there that are listening to our Healthy Veins, Healthy Legs show today that have had an ulcer maybe 5 years ago. They haven't had one since then. How important is vigilance? And how important is when you do notice something that is scabbed over and maybe hasn't healed for a week? Is this another one? What's going on here?
Well, we like to talk about progress over time.
Mm-hmm.
So within the last 30 to 40 years, we've begun to understand it's very, very important to jump on those ulcers early on, correct whatever is causing them. So when you go to see your doctor and he sees you got a sore, he say, well, it's a sore in your skin, and so I'm going to get the skin healed.
Mm-hmm.
So they do whatever and put bandages and so forth.
Okay, let me interrupt because what doctor is explaining is exactly what happened to me. I had a major injury to my leg, and the whole effort was, and it took months, was to heal the puka, because even though I had like 20 stitches down there, that piece of skin was no good, so it eventually fell off. And I'm waiting for the new skin to grow in, and it just didn't.
Okay, sure. No, but that could have gone on for 5 years.
Oh boy.
I mean,
but I know this guy named Kistner, so it went on, but it went on for almost a year.
No, but in a place where there's sophisticated medicine, well, you're going to get taken care of.
Mm-hmm.
But if you're living in the country or you don't have good access to care, that thing may never heal. Anyway. Where were we?
In treating this is, I think, the important thing. you've identified these things, and now we're talking about, in this stage 6, we're talking about an open ulcer. This is something that just I need people to know when it has been diagnosed that that's what you've got, a venous open ulcer that's not going to heal. That I want some closure. I want it to heal. What are we going to do?
So this is where the specialist comes in, and at this point, the primary care doc is probably going to send you on to see somebody with diagnostic equipment who knows about the various vascular problems. And so when you go to that person, then they look at the veins, they look at the arteries, and they separate all this out. And so the important thing is, if you get a sore between your knee and your ankle, it's most likely due to venous disease.
Mm-hmm.
If you get a sore from your ankle out to your toes, it's most likely due to arterial disease.
Okay, which is
diabetic, and it comes into the latter part.
Mm-hmm.
Okay, so it's a really important thing, and anybody can look at their leg and.
You can get both. I mean, if you're a diabetic, you can get the foot sore, and then you can get the venous ulcer.
Or if you get morbidly obese, you get diabetes, and you get rid of the diabetes, and so forth. But you don't get rid of the veins.
Okay,
now,
so let me. I'm very, very comfortable in my skin these days because of Dr. Kistner's treatment on what I had, one of these serious ulcers. So the outside of the external side, healing that is one thing, but what you did for me was you actually went into that vein that had caused this ulcer, and got rid of it. So once you get rid of the source of the ulcer, now healing the skin's a lot more likely. That's what happened to me.
Oh, yeah. Well, not only healing it.
Yeah.
You'll heal if by just with pressure and certain kind of wraps and so forth. You'll heal any ulcer, but if you don't get the underlying fixed, it'll come back.
Yeah.
So you were asking about the chance of recurrence.
Mm-hmm.
So first ulcer, 50% recur. But let's go to late stage 5 or 6, or this late stage of ulcers, where you've had multiple ulcers. Now your tissues, remember we were talking about scar? We have patients in whom all of the skin and all the tissues are really just scar tissue covered by a little bit of what we call epithelium, the edges, superficial skin. So any little scratch on them, they're back into ulcer.
Here comes an ulcer again.
It takes 3 to 6 months to heal it.
Yeah.
So in these people, the recurrence is like 80 to 100%.
So they get afraid to go out. They get afraid to do things because they don't want to ding themselves and have another one of these things.
Oh, yeah. And they get disabled from their jobs and all kinds of things at that stage.
Okay, now, before we run out of time, I want to make sure that you understand what we did today was we gave you a primer, a 101 course, sort of, in the CEAP. CEAP is an agreed-upon progression of 6 different stages of venous disease. It was developed in 1994 or categorized in 1994, and I guess, Doc, is probably one of the most important diagnostic tools that you use, particularly when patients go from, say, one place to another and get treated from one doctor to another to pass the word along.
Yeah, and it helps not only docs, it can help people see where they are.
To know more about this, you're going to have to listen to more of these programs. See, there's this incentive thing here. If you want to feel better and you want to have better circulation and you want to have better veins and healthier legs, you got to listen to us more often.
Hey, wait a minute. We're going to go to another program, though.
Yes, we are.
Another program, and that's about reducing these ulcers by 50% in the next decade. So we need your help there.
Yeah, there you go. And folks, we're gonna ask you to help us out with that. Thanks so much for being a part of our program. We're very, very glad you could join us this time, and please tell your friends that we'll be back again. And once again, we're not trying to sell you anything here. We're just trying to give you a little information about how you can have healthier veins and therefore have healthier legs. So thanks for listening. From Dr. Kistner and everybody at the
Thanks
Kistner
for
Vein
listening
Clinic.
to this edition of Healthy Veins, Healthy Legs. For more information, go to www.KistnerVeinClinic.com. That's www.KistnerVeinClinic.com. And join us again next week for Healthy Veins, Healthy Legs on AM 690 KHNR. Hawaii's Intelligent Talk, AM 690 KHNR, Honolulu, and KHNR.com. A service of Salem Communications. It's 8 o'clock.